So, and we have question, of course, here from one of the lecturer, preclinical lecturer, Nurliza. Assalamualaikum Tan Seri. We are in the process of revising our curriculum for mixed mode Master of Science program. Our external assessor suggested to have an option for upgrading to PhD to make the program more attractive. At the moment, the university only allows those doing a Master of Science in research mode to be upgraded to PhD. Can this be done for Master of Science mixed mode as well?
Interesting question, because PhD is actually research.
Yeah.
So if you want to upgrade, you have to, I don't think you should upgrade. I think you should have a separate PhD program, you know, because very seldom people do master stroke PhD. They do a bachelor stroke PhD, yes, you know. But if you want to do, since this is a specialty, because you asked me about Master of Science, which is different. Master of Science go in the academic route, you know. Remember the route that I showed you from bachelor to master's to PhD, from level 6 to 7 to 8. So there's specific in there. You finish your master's, whether by research or by mixed mode, or by, you can also do master's by coursework, you know. You finish that, you know, and then you go on and do your PhD. But to convert a mixed mode into a PhD, you might as well start straight away. I don't know how, because you have to do in depth. I don't know how much of the research in the mixed mode is good enough. I suppose you have to go through what they call, before you enter a PhD program, there's a committee that evaluates you first, you know, to see whether your research proposal is sufficient for a PhD. Suppose your mixed mode research is possible to deepen it into a PhD, it might be possible. But it has to be case by case. Tau. You tak boleh buat, you do kind of overall, you can convert. Every conversion need to go through an evaluation to see whether the research proposal is sufficient. Because sometimes I notice, you know, you do start with a master's, but you can actually go deeper, and then you want to convert to PhD, yeah, and that has to be evaluated by the committee for entrance into a PhD program. I think that is my answer to that question, because you are doing MSc, yeah. The other one is by Zarina. Zarina has 2 questions, 3 questions. My goodness, Zarina, you're super active. Conversion of clinical masters to level 8. I told you already. Level 8 is, please stop thinking about your specialty programs in this level. We've done the masters, which we incorporated, yeah, with the academic and the professional, but the research is not sufficient to go to PhD level. Okay. If you want to deepen, your masters has to be lengthened. Do students want to do that or not? Okay, you want to deepen your research project to a PhD level, then you can do your specialty training with a PhD component to go to level 8. If people want to do that, again, that is subject to assessment. Automatically, you cannot get level 8. It has to be assessed, and your research has to be deemed to be suitable for PhD subject. You have to go deep. Even if you go into surgery or whatever, deep in that subject, yeah, for a PhD level, yeah. So I please forget about equating this to level 8 and all that, you know, because leave the PhD, the research component level 8 as is. You are doing now, I'm asking you to focus on the red part of the framework and develop your master's program. If people want to do master's and PhD as a side, a master's dah tak payah because we have incorporated, yeah, at the master's level. But if you want to do a PhD, you need to see how you want to convert your research project to a PhD level. Then you talk about level 8. If not, don't do it. Just develop your specialty in the red area, red zone, and take PhD separately. Yeah, because I think that is not well developed. Don't jump into PhD. I think you all are getting so confused with the academic part. You're forgetting the red part, which is your specialty, your specialization. That is not, the framework is not developed for you. Need to develop that framework. And those who want to do PhD, pergilah buat PhD. Not everybody want to do PhD, you know. So if you start putting this together, you have to lengthen your program and everybody buat PhD. Not everybody want to do that. Some of them want to practice as a specialist. They don't want to do the PhD.
Yes.
Okay, what's the next question?
Yeah, thank you, Tan Sri. I think the reason why Prof. Zarina asked that because there's a move by certain group of people who, you know, suggesting that, you know, our master's level is, you know, can be upgraded or can be graded as, you know, level 8. So I think that's the reason.
Well, if they can show us the research is at the level of the PhD, then go ahead. But I tell you, it has to be case by case. Never, you know, you are not PhD level. People will laugh at you. What is this? You're doctor of surgery, you're level 8. Show me your thesis, your dissertation, how you defend your dissertation. Don't talk rubbish.
Yes, right. And I think this is also related to the movement towards a common national curriculum based on each specialty. And, you know, some universities are pushing and wanting, you know, all the other universities, despite we're not ready in terms of, you know, preparing the pro forma and so on, to simply, you know, change the curriculum to a national curriculum. What is your comment?
Pasal ni, can't you all work together? You're all in the conjoint board. Sitting where some pushing towards accreditation and some are not. I mean, firstly, what's happened to the self-accrediting status? There are five universities, the research universities are self-accrediting.
Yes.
You need to go through the Senate. If you all are agreed, you do your program, everybody has done the exam, is evaluated, you can just submit it for Senate that approve, then you can submit the thing for MQR, you know, if the self-accrediting status is still in existence. I don't know, I left university already don't know how many years. If you are not being evaluated after the 5 years, like 20, where was it done? I was VC. I'm sure labs dah kena buat semula institutional audit ni to give self-accrediting status. So I don't know whether MQA is sleeping or the university is sleeping, but you need to get self-accredited so that you don't have to go all this trouble of getting every program approved and accredited, you know? So, okay, so that's point number 1. Point number 2, why are you rushing when you haven't done your framework properly? I don't know, you have a national curriculum. What is this curriculum? Curriculum is based on what? I have not seen it. Somebody promised to give it to me. But is it just the curriculum? Is it on just that basic part? Or the curriculum plus subspecialty? What is it? What is this national curriculum? National curriculum, it should just be a guideline, not for you all to follow blindly, you know, because every university ada dia punya unique features. You must be able to adopt and adapt according to how you want to do the program. So long as some basic principles are followed, you know, but you all cannot be like standardized, systematic, everybody must do it this way. No, it's not. Why do we have different universities and different philosophies and different vision and goals? So respect the autonomy of the universities. So I really want to know what this national curriculum is about, because it can help in forming the qualifications framework for specialties. So do you have like a basic one for medicine, for surgery, or whatever, and then you have then the subspecialty. So does it progress in that way from one to the other? So if I can have this kind of answers, well, you know, I can help you if you all want to have workshops and so on, to enlighten, to show you how this can be done, you know, by just asking you questions, but get the right people in, the special.
Right, that's great, Tan Sri. You're willing to help.
No, I can help, but get the right people in, people with the right attitude. You know, if you don't harp on the level 8, but let's look at the red block, and let's see how we can build the framework for medicine, for training in medicine, specialty training, and the credentialing. What are the procedures you need to credential? How do you go about doing it? I think it's high time we start thinking like this. Now, national curriculum ni kita boleh tengok macam mana dia boleh bantu kita dalam buat qualifications framework for the disciplines, for the medical specialties.
Right. Now, I hope that answers, all these questions raised by all the coordinators of clinical masters, because in a way they are being pushed to start the national curriculum even this year, this December, for the new intake. So we may come up with that workshop, Tan Sri. Thank you very much.
Next year.
Next year, yes. Okay. Then third question again from Prof. Zarina. I'm sure you saw the question, or you see the question.
Marketability.
Yeah, to increase marketability of our local program, is there an international accreditation board so that the clinical master's programs are recognized by various international higher education providers and international registry similar to our MQR?
I've not heard of an international, because the reference point is the country's system, and the only thing they do is they recognize the system of the country for mutual recognition. So we have a process called mutual recognition. It's between two countries, or it can be between 2-3 countries, For example, if like the European qualifications framework, if their inquiry, if their process recognize our process, then maybe the European countries will adopt our qualifications. Yeah, but usually it's done country to country, because it's not just about recognition of the qualification, it's about being able to practice in a country, and that is regulated by the regulatory board of the country. Like in our country, it's the Ministry of Health, yeah, and the MMC. They will regulate the practice, and one of that is the recognition of the qualification. So it's not automatic, the recognition of qualifications is not a license for you to practice automatically. You still have to fulfill the criteria for practice. In some countries, for example, 5 years, you must be 5 years of a specialist before you can practice, and so on and so forth. Language, things like that. Yeah.
Right. Now, Tan Sri, because you mentioned about this license to practice and then MQR, and with this national curriculum, and people are talking about parallel program. Can you comment on that? Because we are being accredited with our program and so on. At the same time, we also have this so-called parallel program, and nobody actually looking at or accredit that program. So what is your comment, or who actually supposed
my
to?
comment? Actually, I have one nice slide. I threw it out because I didn't want to go into the politics of it. I feel that if the profession get together and do the framework, the parallel programs will somehow have to fit into this framework. Okay, actually they are foreign providers. They are foreign providers, and actually to me is a little bit illegal. Foreign providers must be accredited by the Minister of Higher Education that you are a foreign provider, or you have a branch, a representative here. I gave the example of the European Pediatric Surgery Board conducting the exams here, but they do it together with UKM. So that's recognized and by the Europeans and also by our country, but it's done with the university, which is already a body legally constituted for training purposes. Now, the parallel program is done with the Ministry of Education. Ministry of Health. And I don't know whether the ministry is the representative, is it a legal representative of the foreign body, or are they just providing training facilities? And the foreign body lah, betul lah, foreign body, and the college has to be registered and approved by the minister, to conduct the exams here, even if the ministry passively give its facilities. So then the minute the Minister of Higher Education comes in to give approval, they must be accredited. So to me, I believe what is happening is just something that is being pushed through, and the government is sitting quietly and accepting this under the pretext that we don't have enough specialists. To me, there are other alternatives. You can expand the program in the local universities. There's so many other ways of providing more specialists. Padahal, the facilities you are using in the Ministry of Health could be used by the universities to increase the specialists, and it's also legal. Or the colleges could come up and work with the universities to provide the training for extra training. Anyway, there are many alternatives. I think the way it's being done now is a little bit illegal, and I think it is not safe because I think there's double standards. Where's the scrutiny? Who is saying that they're meeting the standards you have set for your program? Who's doing that? And these people, they come out, they are also specialists like your specialists that come out. Now, is this fair? I think it's not fair for the public. Nobody has actually made a noise about the safety and the, of these people to practice. You know, nobody has reported any mishaps or anything, but anything can happen, you know, because you have a 4-year program and this one has, I don't know what program, and they come out and they're certified also as a specialist. I suppose with an additional 6 months. But this is not healthy. I believe if we can, and MQA is also sleeping. I don't know who's in charge of MQA. They should come out more strongly. I think MQA is keeping quiet. That's why this can be pushed through, you know. If MQA puts its foot down or feet down and hands down, I think we can make sense, because the government is very concerned about quality, about safety, about fairness. And if this is not brought to the attention of the government as such, only one sector of the government is interested in producing specialists. As far as the government is concerned, oh, you give me specialists, it's okay. But the government is not aware that there is this double standards. Now, this has to be done properly. There should be a cabinet paper and so on, you know, to bring up the issues. And I think it's the job of the MQA and the Ministry of Education to do this. And universities can help to come up with a good paper to say why this should not be. You know, and if you can have examples of the practice, how this people practice and how your graduates practice, if you can quote examples that would even be stronger and better, you know, in terms of competency and so on. I can give you ideas, but a paper has to be done, and this has to be brought up to the highest level.
Right. Maybe the dean can do this.
I don't know, if people keep on saying this dean will do this, nothing will happen. Somebody has to do this. Kalau saya dalam sistem, memang saya dah buat lama dah. But I'm not in the system, I don't want to do. I'm tired of doing.
Right. Okay, I think there's one more question in my WhatsApp. Apakah yang terjadi kepada pelajar sekiranya institusi gagal dalam permohonan akreditasi?
Where's the question?
This is my WhatsApp.
Oh, okay.
My WhatsApp.
And I told you, you go for provisional accreditation, right? Mm-hmm. This is say it's not a self-accredited. All of you are not self-accredited now, I think. I believe it is not so, because I didn't hear about any institutional audit being done to renew the self-accrediting status, which is a pity, you know. You should get, because once you lose it, then you have to go through the process, you know, of getting provisional accreditation, then getting accreditation. So you get provisional in the beginning, then towards the end, say in the 4th year or 3rd year, whatever the penultimate year, you go for accreditation. Then you will know, you know, your students will know that you are fully accredited or not. If you're not fully accredited, then they will give you conditions for you to be fully accredited, and you must fulfill that so that your students come out of an accredited program. If you don't do this, then you lose, you don't get accredited, your students suffer, you know. They graduate, but they are not accredited. There maybe somebody will employ them, but they're not accredited. And normally people would not employ those not accredited. Yeah, and it's a real big shame to the institution when you are not accredited. You know, something is wrong. So and the students suffer. Student can sue you. No, in the private sector, there's several cases. You know, of universities being sued by the students because they were not accredited.
Right. And another question on national curriculum, really hot topic. Salam, Prof. Tan Sri. I heard the national curriculum program should go through MMC Education Committee. Is it same as MQA?
You can go through, I don't know what this curriculum is. MQA deals with the framework, okay? The qualifications framework. And within the qualifications framework, I told you the criteria, yeah? Learning outcomes, the credits, the nature of the course, the duration of the course, all that will be incorporated under the framework, yeah, the qualifications framework. So I don't know what this is. And the framework, the general one has already been approved by the MQA. But each specialty, each discipline should develop their own. The academic disciplines, no problem. They already have bachelor's, master's, and PhD. But the professional disciplines need to work out the professional qualification framework. What the MQA will approve, the MQA policy committee or the board, not board, committee, I don't know what it's called, I think advisory board or something. There's a committee that looks at policies, yeah? Qualifications framework is a policy. It has to be approved by the MQA. So you can take it to any committee you want under the sun. Unless it's approved by the MQA policy committee, it is not a national, it's not legally approved, okay? Because everything is operating under the MQA Act. Education of the MMC doesn't have the legal teeth for accreditation. You can have it and you keep it in your education committee. But if you don't submit it to the MQA for it to approve it as a national qualification framework for the specialties, it's not going to happen. Yeah, they can use it, but it is not approved. It has to be approved by the MQA as a body. So this is how the law operates. Yeah. Ultimately, it is MQA. I think the medical people tend to forget, no? The engineering board, they don't forget, no, the MQA. In fact, they work so closely with the MQA. Medical tend to, whereas it's stated so clearly in the Medical Act, everything that is stated about accreditation is subject to the MQA Act.
Right. Thank you, Tan Sri. I hope this clear the air of national curriculum and the function of MMC and MQA
Leila, I think we should look at the national curriculum.
Yes.
And see whether it's answering the question of the framework, qualification framework.
Right.
To what extent does it answer the qualification framework requirements? Do we need more things? I told you about the subspecialty, kan?
Yes.
So do we need a nice progression for the framework? Do you go from one level to the next, you know? So that's when it comes to a longer program, when you need a longer training. Credentialing ni dia short aja, dia macam certificate, diploma macam tu kan, short
yes.
courses that you do. I can help you all with this next year.
Inshallah, we'll invite you again. I think that was the last question, Tan Sri, and maybe what we can do is we'll ask the penyelaras to present to you in the next workshop sometime next year, early next year also, whenever you are.
That would be good. Then I understand. Now I talk about national curriculum, I don't even know what it looks like. I'm sure it's very well worked out. I think it's extensive. People have done a lot of work. But let me understand it in the context of a qualifications framework.
Yeah. Okay, then we can, discuss more about on that, right? Okay, I think that was the last question. So thank you Yang Berbahagia Tan Sri for a very interesting discussion. You able to answer, you've answered all our queries and question and so on. So with that, on behalf of Unit Quality and Strategy, Fakulty Perubatan, I would like to thank you. Ada one more question.
No.
Yeah. Okay. So I would like to thank you. Spend your afternoon with us about 2.5 hours already. 2 hours. 2.5 since pukul 2 tadi. Okay. Thank you very much. I'm sure we'll invite you again. Okay. And with that, would like to thank the participants for joining us in this webinar.
Next year.
Yes.
So you're going to get SWA accreditasi next year. Supposed to, somebody said.
Yes, we're doing that.
Okay, you better prepare now. It takes a long time to prepare,
Yeah, we in the midst of preparing, Tan Sri. Ini yang panggil Tan Sri ni nak.
But it's university, it's not at faculty level. It's like university level.
Yeah, Nur Azlina, Prof Azlina, the university, because Prof Azlina is in charge of penolong dekan quality. Kita buat at faculty level kan?
Tak Prof.
Is institutional.
Yang audit pengekalan SWA akreditasi ni UKM level,
UKM
and then pengarah kualiti kata sepatutnya 2020 tapi sebab COVID, I think they delay it to next year.
Okay. So now labs they extended. What you can do is ask for extension so that you all can continue to do your programs without going through accreditation. Ask for extension, lah tulis surat. Since because of COVID, you ask for extension until the next audit that you are still self-accrediting. The self-accrediting cut short a lot of problems, when you're self-accredited. You don't have to send program by program. It's only approved by your Senate. You just send your program for MQR.
Okay. I think with that, I think we end the webinar today. Thank you again, Tan Sri and Prof Azlina and the Unit Quality